today's video, we're breaking down the most common medical reasons why your cycles may be irregular, including things like PCOS, thyroid disorder, fibroids, and many more. I'm Taylor, a physician assistant working in OBGYN, and my goal is to break down everything related to women's healthcare. So let's start with one of the most common medical reasons that your periods may be irregular, and that is polycystic ovarian syndrome, or PCOS. PCOS affects up to 1 in 10 women in the United States. It's caused by a hormonal imbalance, specifically higher levels of androgens, which are male hormones like testosterone, and lower levels of certain hormones like FSH, estrogen, and progesterone. The imbalance in these hormones interferes with ovulation and therefore interferes with your cycles, making your periods completely unpredictable, hard to track, skipping months, and just stopping altogether. If you're suffering from PCOS, you may also notice symptoms like acne, male pattern hair growth, weight gain, and even infertility issues. I just posted a full detailed video explaining exactly what PCOS is, how do we diagnose it, and what some symptoms are. So if this is something that you're interested in learning more about, or you think you may be suffering from PCOS, go check out that video next. Condition 2, thyroid disorder. The thyroid gland found in your throat helps to regulate so many things, from your metabolism to your hormonal imbalance that helps to regulate ovulation. With hypothyroidism, meaning your thyroid levels are lower than normal, you may experience heavier, more frequent periods, fatigue, weight gain, and even cold intolerance. On the flip side, hyperthyroidism, which means your thyroid levels are higher than normal, you may experience less frequent periods, lighter periods, your period stopping altogether, associated with symptoms like weight loss, anxiety, increased heart rate, and heat intolerance. Both types of thyroid disorders can completely throw off your periods, but in different ways. And both are typically diagnosed with a simple blood test. 3, diabetes or insulin resistance. When your body struggles to regulate its blood sugar, like in type 2 diabetes, or in cases where you have insulin resistance, it can increase your circulating levels of insulin within your body. The more insulin levels we have, it can stimulate your ovaries to produce more androgenic hormones like testosterone, which can therefore interfere with ovulation. Insulin resistance in the absence of a diabetic diagnosis is really common in women who are suffering from PCOS, but can also show up in other diagnoses as well. So if you're having irregular cycles and you're noticing symptoms like weight gain, fatigue, frequent urination, or you're noticing darkening of the skin around areas, specifically the back of your neck and your armpit area, it's worth looking into and having your fasting blood sugars and your hemoglobin A1C levels checked with a simple blood test. 4, fibroids and polyps. These are structural growths that happen inside the uterus and are much more common than you'd think. Fibroids are benign, dense muscular growths inside the muscle of the uterus itself. They can make your periods heavier, longer than normal, irregular, and you could even have what we call breakthrough bleeding, or bleeding in between your regular cycles. On the flip side, polyps are soft tissue growths within the lining of the uterus and can cause spotting, unpredictable bleeding, and again, also mid-cycle bleeding. In my next video, I'm going to dive into much more detail about fibroids and polyps themselves, exactly what they are, what other symptoms are associated with them, how do we diagnose them, and what treatment options look like. So make sure you're subscribed to the channel so you don't miss out on it. 5, high levels of circulating prolactin. Prolactin is a hormone that's released from the pituitary gland in your brain, which helps to regulate and produce breast milk in the postpartum period. But when it's elevated outside of pregnancy or the postpartum period, it can interfere with normal ovulation and cause your cycles to become irregular. When prolactin levels are too high, it disrupts the communication between your brain and your ovaries, which interferes with normal hormone production, again, preventing or delaying ovulation. One of the most common causes of elevated prolactin levels outside of the postpartum period is a benign tumor called a prolactinoma, which is a benign tumor found inside the pituitary gland in your brain. Other symptoms may include milky nipple discharge, headaches, vision changes, weight gain, and fatigue. This can be diagnosed with a simple blood test to test your prolactin levels, followed by a brain scan looking for the benign tumor. And 6, premature ovarian insufficiency or premature ovarian failure. If you're under the age of 40 and your periods have become sporadic, very irregular, or absent altogether, you may be suffering from what we call premature ovarian failure. This means your ovaries are no longer responding properly to the hormones released by your brain, triggering ovulation. As a result, ovulation becomes very irregular, very sporadic, or absent altogether, causing your estrogen levels to decline earlier than expected. Besides irregular periods, this can be accompanied with symptoms of infertility and symptoms of menopause or perimenopause, like hot flashes, mood disturbances, sleep disturbances, and even bone density loss. This can happen spontaneously, or it can be related to things like genetics, autoimmune diseases, and conditions like cancer treated with chemotherapy or radiation therapy. Some other possible causes of irregular cycles are going to be certain medications like antidepressants, antipsychotics, high-dose steroids, blood thinners, and again, chemotherapy. Autoimmune diseases is another really common cause for irregular cycles. And lastly, something that's not necessarily considered a medical condition, but something that every woman is going to experience at some point in her life, and that's perimenopause. Perimenopause is a transitional phase where your hormone levels start to gradually decline in preparation for menopause. As a result, your cycles may begin to shift and you can experience a wide range of cycle changes, like having your periods come closer together, having heavier periods, or having lighter periods, having longer stretches of time between your periods, or just overall unpredictability or irregularity in your cycle. And perimenopause can actually start anywhere from 7 to 10 years before our body actually goes through menopause. The key takeaway here is your period is actually a reflection of your overall health. So if your periods have suddenly become irregular, they're hard to predict, or there's longer stretches of time in between your periods, or they've just stopped altogether, it's definitely worth making an appointment with your OBGYN to get it checked out. Blood work, a physical exam, a clear history, and even some imaging can give us a clear picture of exactly what's going on. If you found today's video helpful, make sure to give it a thumbs up and drop any questions you have in the comment section. And if you want to keep learning about your cycles, make sure to check out my previous video here where I talk all about lifestyle reasons like stress, excessive weight gain, excessive weight loss, and over-exercising that can all affect your cycles.